Hello Bibis and everybody at the event today. Thanks to Bibis Roy for inviting me to attend, but unfortunately I'm unable to attend this afternoon because I've already got something in my diary that I'm committed to. But I'm hoping that this short video may allow me to get over some of my thoughts and ideas that will help the event, and obviously it's an acceptable alternative to me not being there today. I first learned about PROMs 2 about 3 years ago from Bibis Roy. At that time it was an early thought and he had this idea and concept he'd like to take forward. I'm pleased to say that Bibis is a member of the North West Clinical Leaders Network, and he took his idea into his action learning set and discussed this with his clinical colleagues. This proved to be successful because they were very supportive of his idea and encouraged him to take it further. Bibis then used the CLN to test some of his ideas and then take the concept forward to apply for funding from the Northwest Innovations Fund. I'm pleased to say he won this, which allowed him to further develop the idea and begin to work with other stakeholders about the production of the software to support his PROMs 2 concept. The Clinical Leaders Network has continued to support him, and indeed recently he had some success in receiving a bursary to further encourage more people to become engaged in his programme, and I'm hoping some of you today will take advantage of those funds. I'm very interested in PROMs 2. I think it's a great idea, very simple but yet highly effective. And the beauty is it really brings the patient to the centre of the care. It encouraged them to gain confidence in self-care, self-decision making, and that enhances their experience of their illness and the management of their problem whilst in the NHS. This has to be a great advantage. It certainly is the way the NHS is moving, and it brings all sorts of values to what we do in many ways, and I'll try and explain some of those. So if we look at the aspects of the situation for the patient, I think by being engaged in this way and using the software, they get a chance to report on their outcomes as they're going along, but more importantly Bibis has tied those outcome reports with the expected reports that they should receive as they're improving from their condition or their problem or whatever the healthcare delivery area is. The patient then begins to feel confident. They can then make some decisions themselves about who to access if they require it in terms of healthcare professionals. In his case with shoulder surgery, the decision about access to physiotherapy, the decision about possibly attending an outpatient appointment, or a decision about actually that they don't need any of those because they've improved successfully and they do not require further NHS follow-up for their particular problem. All of those are great benefit to the patient. From the provider's point of view, it helps them develop an increased level of efficiency. They're getting a better relationship with their patients, and their patients are getting better experience of the NHS that's more in tune with them wanting to actually manage their problem in their home setting if at all possible, rather than attending the hospital unit. It helps the hospital increase its efficiency and also hopefully reduce some of the costs around outpatient activity, which again is something that I'm sure they'd like to achieve. From the Commissioner's point of view, it's an extremely good quality standard. It ticks all the boxes. It helps with the QIP agenda, it helps with patient satisfaction, and it's got outcome measures all the way through. I'm sure many of the CCGs would like to begin to build this into sequins, and as we go forward into the future, the outcomes framework that we've got for the country, the commissioning outcomes framework, I'm sure PROMs 2 will become significantly part of that. From the Clinical Leaders Network point of view, they're hoping to get back information from Bibis and yourselves that reports on the success or difficulties or problems that come from this programme. Obviously we're hoping for success, we're hoping for outcome measures, we're hoping for evidence that we can discuss across the Northwest, expand the idea if it does prove to be successful, and more importantly through this Clinical Leaders Network at a national level we can then take this onto the national stage and the CLMs, hoping that if this is a good idea, it can play its part in spreading the innovation across the country. So in summary, I think PROMs is extremely good. PROMs 2 takes things further. It allows us to consider the patient more as a partner in their healthcare management. Although at the moment most of it is going on via yourselves around the surgical procedures, but I think it's going to be extremely important and valuable as we go into chronic disease management. That's an area that PROMs 2 will become particularly useful to. I'm sorry I couldn't be with you today. I'm really looking forward to hear from the outcome of your today's discussions and event, and more importantly, as you go forward over the course of the year, I'm hoping both within my SHA role and my as chair of North West CLN role to hear the outcomes, to look at the data and information that you produce, and also hear your experiences of working with the PROMs 2 concept. So have a good afternoon. I'm very sorry I can't be with you directly, but I'm more than happy to discuss with anybody this project in a bit more detail, or how it relates to the other evolving NHS and improvement programme that's going on. So enjoy yourselves. I'll hopefully be with you when you have your next half-day session, so I can discuss it in person with you. But until then, have a good afternoon. Thank you.